So you just found out that you have a tumor in the liver or in the kidney, and your doctor recommended something called an ablation. So an ablation is when you use some type of energy to kill tumor. It can be very effective, but what the kind of energy we're talking about? Exactly. Heat, freeze, zap, or scream. You can use heat energy to destroy tumors, and that includes two types of heat energy. It includes radiofrequency ablation or microwave ablation, which are two ways that we can make a needle that is inserted in the tumor become hot enough that they can essentially kill the tumor, they can burn it, barbecue. Now, freeze is quite the opposite, is when we make this special needle that we put into the tumor, essentially freeze and create an ice ball around the tumor, which will also kill it. The third option is to zap it. And that's when we use electric energy and electric current to zap the tumor. That's called irreversible electroporation. And scream, what's a scream? Well, scream is when we use sound. In this case, it's an ultrasound wave to actually cavitate and kill the tumor. It's a very focused ultrasound that can penetrate into the tissue and vibrate those tumor cells to the point that they die. So you have all these options. When do we use each one? I mean, that will really depend on a case-by-case basis, and you have to discuss this with your interventional radiologist. So in general, microwave is a good treatment for liver or for kidneys, especially if you have a very large tumor, because with the microwave can be done quickly, and you can treat a very large tumor up to 4, 5, or even 6 centimeters. The limitation of the microwave ablation and the radiofrequency ablation is that if the tumor is located close to a vital organ, for example, the colon, or the pancreas, or the duodenum, this energy can be high enough that can damage the organ. So in those situations, we may consider cryoablation, which is a little bit more gentle in the tissues. Cryoablation is really well studied for renal cancer, but the limitation of the cryoablation is it's harder to achieve a large size. You need multiple needles. Also, it takes a lot longer than the microwave ablation. Usually it takes at least 30 minutes to be able to freeze a lesion. Irreversible electroporation, it's a newer technique that can be used when tumors are close to vital organs. It tends to spare the vital organs. It has been studied mostly in the pancreas. It can be used in the liver, but you will need multiple needles to achieve the same size. So we usually prefer other options like microwave or cryo. Now the histosonics, which is when we use ultrasound waves to kill the tumor, is a very new technique. Essentially, it only started being used in 2024, but it is very promising. The main limitation right now is it requires general anesthesia to be done, as you have to control the breathing. And also, the lesion needs to be well visualized in ultrasound so the procedure can be done. Essentially, right now, if you can't see the lesion in ultrasound, this procedure cannot be done. But this is going to change in the next few years. Tumor ablation is a great tool to treat cancer. And just remember, heat, freeze, zap, and screen. Discuss that with your doctor. This is Minimally Invasive Insights, and see you next time.